Assalamu alaikum. So I was asked to talk about a little bit what I do um, every day and have 5 to 10 minutes for question about that or general questions. So I am what we call intervention radiologist, and that's actually the best job in the world, but nobody knows about it. It's the, we used to have surgeons going and looking at the problem and then open the belly and get, an abscess out or go and to repair an artery. But radiologists, when they had access to imaging, they started to, when they look at the image, they say, well, I'm seeing this lesion there. Do you want me to fix it? So we use the imaging to get things done in a faster manner and less invasive. So minimally invasive surgery or those type of things that happens without opening, but using imaging became what we call interventional radiology. So that means that we use radiology to treat different conditions. So this started many years ago. Actually, the person who is called the father of interventional radiology is Dr. Daughter, who did his first case exactly 60 years ago, where in the past where they wanted to treat a patient for leg when they had arterial problem, the blood wouldn't go to the foot. They had to do different surgery. This patient didn't have any option. They wanted to cut the foot, and he said, well, if you want to cut the foot, let me just treat the patient in my way. So he started to get through the groin, got to the artery, and tried to open the artery, and that patient didn't lose his foot. And so that started what we call interventional radiology. So there are a lot of different conditions we treat, from liver cancer to arterial disease to, when patients have kidney disease, we can go and drain the kidney, or there's a stone, we can go and treat that. To a lot, I think I remember I was going to give lectures to medical school in Belgium, and I just went over all the procedures we did, and it took 4 hours just to go over everything. So for here, I wanted to just talk about 2 procedures that we do that may be very helpful for general population. One in the women's side and one for the men's side, so to keep the equity here. So one of the issues that women go through is, as you know, women have a fibroid sometimes. Fibroid is a benign tumor that happens to be in the uterus. And the fibroid is not a dangerous disease, but because it is in the uterus, it can bleed and it can be painful. And some of the patients really suffer a lot about it. And actually, in our communities, the rate is very high. It's somewhere around 50% of women at the age of 40 to 50 years, they may have the fibroid and symptomatic fibroid. So the majority of those patients, even now in the US, what they go through was a hysterectomy. So the surgeon went and take the uterus out. The problem is that body doesn't like empty space. So when you take a fibroid and the uterus that is very large in those patients, suddenly everything around this moves. So the bladder moves, the rectum moves, the pelvic floor moves. So those are some of the things that most physicians don't explain to patients. So, and then there are also complications related to surgery. Whenever you open the belly, there may be reactions in the belly. There may be some stricture happening, and then the risk of abscesses and those things. And there's always a very slight chance of mortality in those surgeries. So what we have developed in radiology was that we could go through the arteries and get to the artery that feed those tumors, the fibroids. and we inject some particles, some so like beads that are plastic beads, or we are working on different type of beads to just close the blood supply to the tumors. So what happens when there is no blood supply to the tumor, tumors start to hurt, and so start to die. And so sometimes after the procedure, it's a little bit painful for the patient, but we give all the pain medication. And then when the tumor dies, then the symptoms go away, and the whole fibroid and the whole uterus start to shrink. So we have the first case that was reported, and that was 1995. At that time, I was in Belgium. I did the first case in 1997 in Belgium, and then the first case in the U.S. was done in 1997. So 95, 96, 97. So sometimes I show off here. I say I did the fibroid before anybody in the U.S. has done it, but just between colleagues when we want to show off. But the through the prostate. And urethra sometimes get compressed by prostate when prostate starts to increase in size. And that happens also to the majority of men. So from this group, 8 out of 10 by age of 70 will have prostate problem. So those problems can be mostly something that can be treated by some medication, but the most important symptom is its frequency. A lot of men need that treatment. So the same way that we treated the fibroids, we can treat the prostate. So but it's a little much harder because prostate is generally a smaller organ than uterus, and the arteries are much smaller. And also the patients that have enlarged prostate are older than women who have fibroid. So for us, treating a woman with fibroid is very easy. It can be a procedure that can get 30 minutes total or 40 minutes total. For a man with prostate, is mostly older man, his anatomy is more difficult because with age the vessels become more tortuous. And so it's a more difficult procedure, but still much less invasive than all the alternatives. So what we do, again, we try to find the way into the arteries that feed the prostate, and we block that with small beads, and it takes really a small amount of beads. And so this procedure was invented, again, a lot of these procedures were invented by accident, where the patient had a bleeding and large prostate. We treated the bleeding, and then they realized the symptoms of large prostate went away. And so, God has always ways to teach us some new things, and that's one of the things that happened. Exactly the same thing happened for the fibroid, where a patient had bleeding. They wanted to stop the bleeding to get hysterectomy, and then 2 months later, nobody showed up because they didn't need hysterectomy. And so that's how this came up. So for this procedure, usually we bring the patient in, we go through the groin here or through the artery in the radial artery, and we go to the arteries that feed the prostate, and we close the blood supply. That changes the prostate from being a solid, big organ to a softer organ. So the urethra that goes in the middle gets less compressed, and so the symptom improves significantly. So usually those symptoms improve within the first month, and by 3 months the patient is doing very well. The outcome of this is about 90 to 85 to 90% of patients really improve after this procedure. Of course, the selection is very important. Those are some of the details. I won't bother you with that. So the first case was done by accident at Yale with a doctor that is still there. And then a Brazilian doctor, Dr. Carnevale, in 2009, he did 2 cases. And then in 2011, a physician in Portugal, Dr. Pisco, who's recently passed away, he did a series of cases. And in 2011, I went to see, because I didn't believe that could happen. But then I went and saw how it worked, and then came back, and we did the first case in the US at the University of Minnesota in 2012, for which I went to TV. Some of you may have seen that in 2012. And so since then, we have been doing this procedure, and with really good results. And again, a lot of patients that I receive now are patients who have been offered surgery, and they didn't like the complications. They just search on the internet, and they found me, and they come to us. So I think, again, that's if you learn from all of this, is that there's always other alternatives. Do your research, talk to people you know, and then go for the treatment. I respect a lot of health be it potential patient, is important. And just don't believe that every doctor knows best. That's not true. They know what they know, and sometimes they are biased by the, there's a business anyway. So and the ego. So you have to be just sensitive. I don't want to say that all the doctors or dentists or pharmacists are like this. It's like everything else. You have good and bad and ugly everywhere, and some of these. You need to know that responsibility of the health comes back to your shoulder. You need to be the person who take care of yourself, and just do your due diligence before making an important decision. The same way when you want to buy a house or a car, how many time you spend on reviewing the price and negotiating and go and get 10% off this and the other, is your health is not different. So. I was asked to finish at 35 and then open it for questions. So we have a question, Brother Muhammad.
Doctor, Assalamu alaikum. Thank you so much for this very, very important information. What you just said, that there are two procedures which the radiologists do at this time. Is that correct statement?
These are two examples I gave you. Yeah, we do, I don't know, 40-something different procedures, but these are two examples, yeah.
Because I was reading an article last week. In that article it said that the time has come or is coming for the radiologists to do the procedure while they are doing the
imaging, yeah.
Exactly, by reading that. So, is this the procedure with everything they are going to, radiologists is going to take over? Like, if that is the case, then are the surgeons going to be out of business?
So that's a very good question. Surgeons, I remember in 1996, I was in a meeting, and that was 30 years after daughter invented interventional radiology. I was in a meeting, a vascular surgeon said, you go inside the artery and balloon it. We know the disaster that you provoke there. We open it, we see it in life and everything. But as soon as the stent came out, vascular surgeons were going to be out of business. So what they did, they say, well, why don't we do the same procedure ourselves? So they started to jump into it and try to do it. And unfortunately, a lot of them had no training. But a lot of people don't know. So you just go there, and there is vascular surgeons say you have a lesion in the iliac artery, you have to go and balloon it. And you go and balloon it, but the guy didn't have the experience. So vascular surgeons were going to be out of business, or other surgeons. But some of them just try to learn. Some of them just try to do the procedure. So there will be those turf problems all the time. That one thing that one group creates is affecting. You may not know, but the coronary angioplasty and coronary angiograph was also created by interventional radiologists. But now all the cardiologists do it, not us, because they had access to patients. So it's a lot of dirty politics that happens. Interventional radiologists, because they are diagnostic radiologists where they just read, but the interventional radiologists are those who actually do the treatment. So if you have some condition, then that can need surgery, just take a look, or here you can call me, but take a look to see if there is any alternative that is minimal invasive. The reason interventional radiology is interesting is because it doesn't have to do surgery. You don't have to do surgery. You don't have to open anything, and that's better health, healthy patients sooner going back to the normal life and all these things.
Thank you, Doctor.
Okay, so Dr. Golzarian, thank you so much for your expertise and sharing your knowledge with us. So if it's okay with you, we have some time right now. We want to take this chance to have a discussion with you, ask you some questions. Are you okay with that?
Of course.
Okay. So the first question we have is that we know that heart disease is the leading cause of death in this country, right? So can you go over what the signs are of a heart attack? And let's say I'm having a heart attack and I'm alone. At that point, what steps do I take?
Good question. So, so there are different symptoms of heart attack, and they are not all the same, and every patient is different, depending on the history. So if you have a hypertension or diabetes, the way you may feel the pain is different. But generally, the most important thing that we know is chest pain. Chest pain that comes and is heavy chest pain. You feel that somebody is sitting in your chest. And so if you have a patient that is at high risk and has a chest pain, the first thing, the second thing, the third thing you think of is heart attack. So, but it can be other things that you can have. So sometimes patients don't have chest pain, but they have arm pain or back pain. So very often it's chest pain and left arm pain, and that's related to the nerve anatomy. So chest pain, arm pain, sometimes back pain. And then in some situations you can have no pain but difficulty breathing. So suddenly you realize, especially after an activity or after heavy meal, you know, the Khoja meal at after Ramadan, you know, and be careful, because sometimes after the meal you start to have pain because your body starts to work hard. So body is going to get the oxygen to digest, so oxygen doesn't get to the heart if you have a narrowing. So back pain, chest pain, shoulder pain, and difficulty breathing, and sometimes the only sign you may have is nausea and vomiting. So, and that's also mostly after food or before night. So if something like this happens and you have chest pain and you especially think that you have some risk factors, what are the risk factors? Smoking. Honestly, if I was an Ayatollah Uzma, I would make it haram and I think some Ayatollah Uzma make it haram, but it is, I remember my exam, an pathology exam, we had 1 hour exam and the whole hour was on all the disease that tobacco will give you. Same thing with alcohol. So smoker, diabetes, hypertension, those are some of the patients. Stress patient, you know, those are people at high risk of heart attack. So if that happens, the first thing you do, call 911. It's important. Say I have chest pain. And the second thing you do, if you have aspirin, take 1 aspirin and just chew it. Because aspirin will make your blood a little bit thinner. And so if there is a good data showing that if you have you start heart attack, you take aspirin, your survival is much better. So these are the first two, and then you don't drive. You have the ambulance come in, because when you drive, you never know when you will go unconscious, and that would be the end of it. So those are the most important thing to do. And if you have somebody with you, sit down and have somebody else help you with that. But call ambulance more than driving yourself.
Thank you, Dr. Golzarian, for going over the signs, symptoms, and also the preventative ways in which you can avoid having a heart attack. But as we all know, going into medical school is quite a feat. So if you could kind of go over your steps on becoming a physician, as well as maybe some advice you could give any pre-meds or anyone that's interested in any healthcare positions.
Great question. So my journey was a little bit different. We were the post-revolution generation, which everything was for Allah and everything was for good cause. So with my brother, we went to Belgium and we say, what can we do to help more people? And we were good students. We go to medicine. I think things are different now, but I truly recommend for those who want to go to medicine, please don't do it because you think you are going to get more money. Or, you know, go to medicine, you will have a comfortable life, but it's going to be needing a lot of investment and a lot of effort. So if you calculate the time you put on that, you do anything else with conscious and hard work, you will be more successful in terms of money. So I would say to everybody, if you want to go to medicine, money should not be a reason. By the way, anything you do well, money will follow. So don't go for money, go for quality, and money will always follow. But please don't lose your time going to medicine if it is for money, because there are so many better ways to make money, and you know in our community there are a lot of richer person than doctors. So, so that's the one message. But the other thing is that really here medical schools, they are asking a lot of questions to see why you go to medicine. And the most important thing, in my opinion, for any healthcare provider is to have compassion. And compassion for everything is good, but if you have compassion, you go to medicine, you don't see patient as a client, but a human being who is suffering. And sometimes when you are in the receiving side of a healthcare provider or treatment, I sometimes feel somebody even hold your hand in a nice manner, it makes you feel much better. And so that compassion will make the difference between a good physician, an average physician, or an excellent physician. I think those are some of the things. So if you want to go, and then of course, you need to be committed to hard work, both in dental school and medical school. But dental school, the advantage is a little bit shorter in terms of duration, but you need to work hard. You need to know that for 10 years you are going to work 8 to 10 hours a day of studying and be committed, but really compassion is the most important thing.
Thank you. And Dr. Golzarian, you're a very successful physician, and you've been doing this for quite a while. So you shared with us some common cases that you see in interventional radiology, but is there a case that sticks out to you that you say, that was a very intense or that was a very complex case that you can share with our audience?
Well, we do a lot of complex cases, but what I can tell you is just one day I was in Iowa. I was watching, it was a Friday afternoon, and looking outside the garden, and I was deeply thinking about some of the issues we have at the hospital, about the turf problem, vascular surgeon. And then my neighbor was a guy called Glenn. He said, Jaffer, what's going on? You seem to be worried. I said, no, I just was thinking. He said, come over. And so we sat down, and he asked me to go over the last week and see what I have done. And it was a very good exercise, and I recommend all of you to do that sometimes. And so I look at all the cases I have done, and I realized that there was a 20-something-year-old who fell from second floor and came with massive bleeding that was going to die, and we went and closed the blood supply to that area that was fractured, and the patient actually survived that. And then I look at my cases for a week and realize that 4 patients in that week, they were destined to death. Of course, death is, Allah gives it, but medically, these patients were supposed to die, and my intervention, thanks to God, helped them to survive. And we say in Farsi, and I think in every other language, that doctors are just a tool. Allah gives the health and the life. So, but we were the tool. And so he made me think that, don't take your work as granted, but think of all the things you can do sometimes. And sometimes you forget that because it becomes like a job. But when you sit back and look at it, you see that you have impacted the life of a lot of people. And sometimes during the calls and complex cases, when you look at this and you look back and say, I'm going there, alhamdulillah, I'm saving, impacting people's life. And again, every work can do that, in any work you can do that. But I think those are some of the good moments where you start to reflect back and say, alhamdulillah, I was useful this week to do some meaningful work. And so those are some of good memories I had.
That is some great advice to share, Dr. Golzarian, because yeah, every job has its own benefits and ways to help out people. But another question I have for you is, you stated kind of through your speech here is that there's lots of distrust within the medical community with like patients and all that, maybe due to incentives or ego, and especially after COVID-19 pandemic with so much misinformation going around. What advice or resources you can share to like the general public to navigate the healthcare system and to make like the best possible choice for yourself?
A great question. I think first of all, I'm mostly talking to the younger generation. It is extremely important to be well versed in different things. You know, the news, reading every day some articles, listening to the news, following some of the things that you are interested. So I think get yourself involved in trying to learn the things that are happening. Because we, very often we go to work and come back at home and we are tired. And what is the first thing we do? We just turn off on the TV and we realize that for 2 hours you are sitting there and watching nothing. And sometimes you watch a good movie and that's great, but I have seen situations myself. I've seen a movie that I've seen 10 times and I just watch it again. So what I think is that, first of all, you guys need to know the people who know more, they are the most successful. So read, listen, when you drive, listen to things, and healthcare is very important. The capital that we have is our life. You can't buy a second of your life with anything you give away, right? You can be a billionaire and say, I want to live one more second. You can't, right? So don't lose your time on things that are not worthwhile. So that's one really good comment about anything. But regarding healthcare is that when it comes to a situation where you have to make a decision for yourself, for your parents, for your grandma or grandpa, use the resources in the internet. Internet is amazing. And by the way, if you guys, I'm sure you know better than me, the ChatGPT and those type of things. It's not only for cheating in the exam, but it's also very helpful for those type of information. So go to the internet and look for it and try to read and understand. If you know people, in your community, friends, a physician, just ask them, Same thing, the dental school, there are, mashallah, brothers like yourself, very successful. And so try to connect with those people. But social media is an amazing tool for getting those information. And now more and more doctors are trying to go to social media and give those information. The information is there, you just need to go and look for it. But to get used to that, you just need to have a routine, and that routine is to be curious about everything that happens. I think it's our responsibility to be knowledgeable. And you look at some of the ulama, you'll be surprised how they know about medicine, about physics, about religion. It's not only one thing. And there are people that in the, we call them mu'allim, teacher. There were only 2 teachers in the history, and those are people who knew every part of the science at their time. So Abu Ali Sina, or Avicenna, as they say here, he was not called a mu'allim because he was not the best at music, for example. So have that curiosity about everything that you see, and I think that will be the best thing, best advice.
Okay, thank you so much for these descriptive answers. So I think we have time for maybe 1 or 2 more questions. So if you don't mind, I know you've been up there for a while, but I think we'll roll through 2 if you're okay with it.
Of course.
Okay,
I have time.
So what I want to ask you is, you've mentioned a couple times throughout the course of your presentation, the connection between medicine and Islam. You've talked about yourself as like a tool by Allah, or a tool of Allah. So can you speak more to that connection between medicine and Islam?
Yeah, I think is first of all, it's not only Islam, it's all the religions, but the first thing that you need to put in your mind is that we don't control anything. We don't own anything. Everything is in the hand of Allah. So that's the first thing that we need to know. I just tell you this is that every day when I go to work, I say, Allah, I know I am a tool. Just make sure that I will be helping your bandegan, how do you call it, your creatures, the way you like. And so it is very important that you rely on Allah, and know that health, life, death, wealth, everything is under His control. So for us Muslim, I think it's very important to know that and believe on that, because when you do something and people start to applaud, or you do the first thing in the country and you go to a podium and you present something, it's very hard not to become arrogant. And as soon as you become arrogant, that's where you see Shaitan gets out of the paradise, because he became arrogant. So I think it's very important for us to understand that no matter what level of success you are just small part of a huge universe, and it's because of Allah that you are there. So I think it's a personal training that know that there is no difference between a physician or someone who is cleaning the street, or someone, we are all human beings. Allah put us in this situation. And of course, people can make judgment error and not be successful at the beginning, but that doesn't allow us to judge them differently. So the other thing that is extremely important for anything you do is the niyyah. I always say, Allah is not there with a piece of wood and say, ask the question, I may give it to you, or I may not, or you are a bad boy, you are a good boy, this time. No, you ask Allah, He will answer you, right? So the answer may not be the way you expect it, but I think it's very important in your heart. Whatever you want to do, you just sit down in the morning after prayer, just talk to your God and say, Allah, I want to do that for your sake. You don't necessarily have to do crazy things, just say it. I think it should come from your mouth. It's not, even sometimes you do it in your heart, it's good, but I think practice to talk to Allah, and that's enough. And after that, everything you do during the day is become ibadah, because you are doing it for Allah. Even if you are running to go and get something to eat, to go and see your patient, or to go and study. So to be able to connect everything to your life and have an easy life is to have that connection with Allah. And for healthcare is even more important, that Allah is sending you someone. By the way, as you know, in Saifeh Sajjadiyah, there is a dua for when you are sick. And when you read that dua, sometimes you want to be sick, because the amount of forgiveness Allah will give to someone who is sick is amazing. So when someone sick comes to you as a doctor, as a healthcare provider, is a gift that Allah is giving to you, because that person at that time, all their sin is going to get, at least when it's not haqqun nas, is going to be pardoned. And so you need to look at that as a gift of Allah to you, and you need to treat that as a gift of Allah deserves to be treated. So I think if you look at this in your life, you will never go wrong, or if you go wrong, you come back very quickly. And then you will see also the outcome in your result. I truly say, and I say it all the time, I am more lucky than good, because they don't understand the definition of that Allah is helping me is not because I am good. And sometimes I say there are two angels going in the tip of my catheter and put there where I want to. I can't do that. There are those angels are doing that. And I think, I totally believe that every success is related to Allah. We are just playing around.
That's amazing. So thank you so much for that answer. So right now, me and Saman are out of questions. So we're going to open it up to the floor, and I see a hand up. Rizwan Uncle has a question. 2 more questions. Okay, so I'm going to pass the mic off to our audience, and
Sure.
they will ask you a question.
Assalamu alaikum.
Alaikum salam.
I just have a quickly two-part question. The first one is, you mentioned minimal invasive surgeries earlier. How open is the FDA? Because looks like when you said you be your own doctor, most of the public, they listen to their doctor, and how open is the FDA to this kind of surgeries? Number two is, can a young person have, you mentioned prostrate, can a young person have prostrate, and what can they do to prevent, or maybe like exercise or anything like that to prevent prostrate? Thank you.
Very, very good question. So the first part of it is for FDA. FDA is usually regulates new drug, new material. So you are right that for anything new that we want to use in patients, we need to have FDA approval. But FDA and more than FDA, the insurances, they are very supportive of minimal invasive procedures because their hospitalization is much shorter, the cost to them is much less, but they have to go through a series of serious study to accept that. So for example, the prostate artery embolization that we are doing is more than now 15 years in the market, but some insurances still don't approve it because they want to see a lot of serious study, and there is also some politics. So urologists push not to get that approved because they don't do that treatment. For the prostate, I think there are some of the things we can do is, as you say, sport is important. Patients with smoking, actually, they will have more prostate issues than those who don't smoke. Diabetes can also affect that. But I think staying active and having some healthy diet, especially for those who start to have some prostate issues, is to make sure that you don't drink too much caffeine or coffee or tea after like 2 p.m. You don't drink too much fluid because you wake up at night multiple times. So there are some changes in your lifestyle, but in general, the majority of prostate issues is related also to hormonal activity. So those are some of the things you can't really change. But I think if you stay active and you have a good hygiene, you may postpone it, but most people will end up having large prostate.
All right, so at this point, I'd love to continue. Do we have another question from the lady side?
There is a sister, Barb, that has a question.
Sure, sir. I'm going to bring the mic over.
She has always
Okay,
difficult
that works
questions.
too.
My pleasure. That's a great question. If you need a referral to come and see me or interventional radiologist, no, you don't. No. You just find them and call and say, I want to come, and we will take you with pleasure. No problem. Thank you for the question.
All right, so this has been amazing. Thank you so much. I'd love to continue, but unfortunately, we're limited by namaz time. So Dr. Golzarian, thanks again for coming out and sharing your time and knowledge with us. And hopefully we can do stuff like this again in the future with you, and this interactive session has been amazing. So thank you so much.
Thank you for the invitation.
And right now we have an announcement, and we'll move on to Qasida after that. Muhammad wa ala Muhammad salawat.
Thank you so much, Dr. Golzarian, for that. And we look forward to everybody's feedback. If you guys enjoyed a session like that, we will be doing different types of sessions with the weeks to come ahead. Just a reminder about the programs for the rest of this week. There will be Salatul Jummah starting tomorrow at 1:10 p.m., which will be led by Syed Muntadhir. On Saturday morning, starting at 6:45 a.m., there will be Tafsir with Syed Muntadhir. Tonight, we have a very special night. We are observing the Sharwate Shadi Majlis for Brother Mikayeel Mulla and Sister Insiya Syed. The wedding will be next week. Is that right, Mikayeel? All right. So unfortunately, there was no lecture to give you any advice. So I decided to come up with 2 advices for you. For those of you who do not know, Mikael's wife-to-be is from Chicago. So number 1 is Mikayeel. I know you already changed to a Jets fan, but make sure you stay a Green Bay fan. And number 2 is do not let go of volleyball. With that, I think you'll be very successful in your marriage. But seriously, we do pray for the happiness of both you and your wife-to-be, and also the families. Congratulations to both sides of the families. Murtazanko was supposed to send me a video. I never got one. But maybe next time we will do it for his anniversary. Inshallah, their wedding will be next week, so we keep you all in our prayers. With that, we'll have Qasida, and then we'll have Ziyarat al-Waratha following namaz. Muhammadin wa ali Muhammad salawat.
أفضل الصلاة محمد وآل محمد ہے آج فاطمہ سے مولا علی کی شادی کہ ہے آج فاطمہ سے مولا علی کی شادی جبریل مرتضیٰ کو دولہا بنا رہے ہیں جبریل مرتضیٰ کو دولہا بنا رہے ہیں جبریل مرتضیٰ کو دولہا بنا رہے ہیں سب عرش فرش والے ہاں سب عرش فرش والے خوشیاں منا رہے ہیں جبریل مرتضیٰ کو دولہا بنا رہے ہیں کہ بعد صبا خوشی میں اترا کے چل رہی ہے تہذیب آج پھر سے کروٹ بدل رہی ہے جنت سجانے والے ہاں جنت سجانے والے دنیا سجا رہے ہیں جبریل مرتضیٰ کو دولہا بنا رہے ہیں کہ دل دل سوار مولا پیدل روا دوا ہے سوار مولا پیدل روا دوا ہے کہ باراتیوں میں شامل نبیوں کا کارواں ہے کرنے کو خیر مقدم ہاں کرنے کو خیر مقدم سرکار آ رہے ہیں جبریل مرتضیٰ کو دولہا بنا رہے ہیں مقداد ہو کہ کمبر سلمان ہو یا میسم ہویا کہ سارا فضا ہویا کہ مریم صحرا علی ولی کہاں صحرا علی ولی کا سب مل کے گا رہے ہیں جبریل مرتضیٰ کو دولہا بنا رہے ہیں. جبریل مرتضیٰ کو دولہا بنا رہے ہیں. محمد وآل محمد صلوات.